Okay, hi everyone. A week ago we held a conference on telehealth, and I didn't turn on the recorder. It was a Zoom webinar. I didn't turn on the recorder, and I'm now re-recording the presentation I made at that conference. So hopefully this will be even better. Although we'll miss the back and forth discussion with the audience in this recording. I'm Dr. Glenn Clark, and I run I'm the director of the Orofacial Pain Oral Medicine program, the center at the Herman Ostrow School of Dentistry of USC. And we're holding this so that dentists in practice might be able to better connect with their patients and provide advice to their patients, and maybe even when time is money, charge for their time. So that's the presentation. Why am I doing this? Well, one, I have an interest in the area. Two, I can drink coffee while I'm presenting. And three, 20 years ago, I was running an orofacial pain clinic at a university, and I was guest editor for a journal of the California Dental Association journal, and we titled it Teledentistry. We had lectures by lawyers, we had lectures by futurists, we had lectures by public health faculty, lectures by oral medicine faculty, and myself. Not lectures, but articles in that journal. And it was 20 years ago. Now, the thing to know is that don't read anything you wrote 20 years ago, because it's probably wrong if you were projecting about the future. And this article was, we were interested in teleconsulting between practitioners, not directly with patients. So that's changed. We definitely have to go directly to patients now. So let's go into a bunch of questions, and I'll try to answer each one as I pose them. First of all, what is teledentistry, and is it legal? You'd think it wouldn't be a question of legality, because patients call you all the time and talk to you and ask you what to do, especially patients of record that you know, and you can give them advice over the phone, and that's a teledentistry interaction for sure, even though it's just phone-based. But there are places where if you do not do a tactile exam, this is Texas now, then it says you can't charge for it. This is new patients, not patients of record. So that is out there, and I think it's to prevent misuse of the system. But let's talk about it today, now, and what we need to do in the COVID-19 crisis, and how we can make this part of our practices in the future. So what is it? One, is not forbidden in most states. And when it isn't legal by, that's a broad term, that means you can't charge for it, because for new patients of record. It's not clear if you have a patient of record and they do a teleconsult whether you can charge for it, but you'll have to call your individual state board, your individual malpractice coverer, and get answers to these questions, because you might be from a place where I don't know the laws or rules. So what is it? Let's go into that question. Well, it's consulting with new patients. Maybe there's a patient who wants your expertise and lives hundreds of miles away from you. It's nuts to have them drive 200 miles, 4 hours, both directions, to find out if you can help them. Maybe you can help them with a teleconsult, or direct them to where they can get help, especially if you have unique expertise. It's reviewing the results of treatments for your patients of record. So you prescribe a medication, antibiotic, anti-inflammatory, in my case, maybe one of the adjunctive pain medications. How are they doing? Do they need to come in physically to tell me that? I could probably do it with a consult. Certainly emergency patients. Oh, I've got something new. It just developed. What is this? All right, let's talk about it. Let's see it if we can and decide. And it can be phone, video, or text, but I prefer video. That's where we're going. And it can be synchronous or asynchronous. They can leave you a message. You can respond to them by message. And not have direct personal back and forth, but asynchronous back and forth. I put this slide up here, and I just grabbed pieces from various places, the ADA News, Texas, the interpretation of the Texas statute that says it has to be tactile. HIPAA, what you have to meet when you deal with HIPAA issues, and various boards that have passed laws saying teledentistry is acceptable and appropriate depending on what you're doing. So that's that. And you can go on the internet and look up teledentistry and find all sorts of stuff. Just don't get sold something up front. Study it, learn about it, talk to experts before you buy anything would be my advice. If you are consulting with a new patient via a video conference, or one you have not seen for quite a while, maybe by definition they're a new patient even though they may have a record in your office, but you haven't seen them in 3 years or something. Can teleconsulting for oral disease be performed, and is it accurate? Now, I deal with oral pain and oral mucosa. Now, pain, of course, is not a visually evident thing usually, and so that's easy. But diseases of the mouth and tissues of the mouth might be harder to imagine how you could do that over the phone. But here's I'll show you the abstract in a second. And so the answer is, let's catch up here. So 1, TD, what is it? And can it be done? And this talks about, this abstract, we'll talk about it in a second. But my answer to that question is, can it be done? Is yes, it can. And is it accurate? It depends on the question you're asking. If you have a patient who is just getting an update to you about their medications, or how they're cleaning their mouth properly, or their denture properly, absolutely you can do that over the phone. But if your question is, what's that lesion inside your jawbone, you can't do that over the phone unless you have x-ray vision. And that probably wouldn't work if you were on a video conference. Anyway, so some things can't be performed over the phone, and some things can. This abstract that I mentioned here was done out of France, and basically, and it's really, really important today, I just lost my mother a while ago. She was in a nursing home, and I spent time with her, and I enjoyed the visits with her, and I was there at her deathbed. And so many people cannot go to the nursing homes now, and their relatives are passing. So can we do it indirectly? And most nursing homes are not set up with a camera, that in a monitor you can take to the bedside and talk to your family member that you love. But here's a guy that he went to a nursing home. Well, he sent a video camera to a nursing home and asked the staff there to examine the patients. And based upon the video camera, they made some suggestions of what the diagnosis would be for those that were visibly evident conditions. And oral diseases often are visually evident. And then they followed up with an actual visit where they examined the patient with their hands and mirrors and stuff. And they said, gosh, the video conference was 94 almost percent sensitive and 94% specific. If they didn't have it, we saw they didn't have it. If they did have it, we saw it and we got it right. So, depending on the question, it can be done. And you know whether the issues you're dealing with are visibly evident. Now, if a patient's a long distance away, you might be able to get them to some place where they can get an x-ray, and then you can look at the x-ray. That's store and forward, obviously. But some of the lesions in the oral tissues and the process involve visual inspection. Now, there are inexpensive and fairly good quality intraoral cameras that a staff member or a caregiver, if your family lives a distance away and they have an in-house or temporary caregiver, that they could use to inspect their teeth. these things are not that expensive. There are dentists that give out electric toothbrushes to their patients as a thank you for being my patient kind of gift. And these are about the same price, a little more maybe, but not that different. So there are options for you to interface with patients and do visual inspections. Okay, so number 2 was TD accuracy. And is it accurate? It can be, depending on the question. Okay, which healthcare areas, including dentistry, are best suited for teledentistry? Well, of course, I'm very interested in pain, and that's what we deal with. TMJ disorders, various neuropathic pain conditions, various headache disorders, various mucosal disease disorders in our center. And so a lot of our patients we can deal with. It's a really quite good fit. But in oral medicine, many of the conditions are visibly evident, not all of them, but many are. So that might be another good fit. And certainly health maintenance programs that you might be doing with your patients that have to clean and brush differently, results of new treatments that you've rendered, a root canal, a new crown. You can do a follow-up and check with the patient. They don't physically have to come in always, and so these things are yet to be determined. What is the best fit? But certainly orofacial pain is. So what areas? Well, OFP, certainly. And, oral medicine, probably. All right, here's another question, and it's based upon this background information. I went to a teleconsulting conference a couple years ago, and they had somebody from Noridian, who is the manager for all Medicare, at least in this part of the country. And I asked the question, can dentists charge for a teleconsult? And the answer was no, they cannot. Very definitely. And yes, the Center for Medicare and Medicaid, CMS, has listed physicians, nurses, physician assistants as legitimate Medicare and Medicaid telehealth providers. And that's because they have this narrow view of what dentistry is and what it does. And so they said dentists, physical therapists, occupational therapists, chiropractors, all cannot do Medicare billing based with a teleconsult. And maybe that law will change in the near future, but I don't know if that it will or not. And so that's the background. So here's the question. If you are, and some dentists are Medicare providers because they can charge for certain things, especially in orofacial pain, where our patients are often Medicare holders of insurance. If you are a Medicare provider, but not one of the approved providers, so you're a dentist, can you then charge your Medicare patient directly? Say, okay, I can't be a Medicare provider for telehealth, but if you'd like to see me by telehealth, then I want to charge you, and here's what it is. If you agree, then we can go ahead. Well, that's a questionable area. So, number 4 here, I'll change colors. Number 4 is Medicare. And Medicaid to a lesser extent. You can't bill Medicare or Medicaid as a dentist. So if a patient agrees and wants to, can you agree to charge them directly? Well, the answer is not known. There is something called a ABN form. N. That's a Advanced Beneficiary Notice of Non-Coverage. And with that notice, you can instruct the patient that this will not be a covered benefit, and therefore they're responsible for it. And if they sign it and they agree and you have that form on file, then you won't get, hopefully, won't get audited by Medicare if somebody gets angry at you and files a complaint. But this is it's not a simple form. And most dentists are not Medicare providers. So if you're not in Medicare and the patient understands that and they've signed a release saying, I understand I cannot bill Medicare for any of the services you provide, then you can just charge them directly. There's no rule. But if you are a Medicare provider, you probably need the ABN form, and then that law has not been established well. Will audits uphold that form if you have it? Probably it will, because this is an official form. And here's the copy of the form. You can get it off the CMS website. You look for ABN, Advanced Beneficiary Notice. All right, here's another background. All right, you decide to do a teleconsult in your local area, and you're a dentist, and you have a patient calls you up and said, Doc, I've got this missing tooth. What do you think? Can I get it replaced? It's right here, and they can show it to you, and you can decide. Maybe they even have x-rays that they can send to you in a Dropbox for a second opinion, or maybe a first opinion. What do you charge, and how much time do you spend with them? Obviously, you understand what you do with your patients of record, but with new patients, can you do this? And the average, if you look out there for the various telehealth, telemedicine, teledentistry systems, they're about 15 minutes consult. And they charge a fee anywhere from $30 up to $90 for that time. And you can decide what your fee is. I'm not telling you what the fee should be. You can find these numbers on the internet easily. Just charge a fair fee is the answer. How much time should you spend, and how much should you charge for a chronic pain patient, which takes a little longer? Oh, I've been through 7 doctors and I've had this many treatments and they all did this wrong, and so on and so forth. And the more complex patients, the simple ones, easy. You can get to the point right away. But some of the more complex patients, it takes a long time to get to the story. And you can't sort of bypass it and say, well, just tell me what's exactly wrong today and I'll recommend something for that. No, you got to get their full story. So how much do you charge? Well, we charge by time. We set up the appointments for 20 minutes. And if we feel that the story can't be achieved in 20 minutes, we'll ask them to schedule another visit and we'll continue. We need about 10 minutes for making all of our notes and making our recommendations to document that event. So 20 minutes on camera, 10 minutes after, and get ready for the next one if you have multiple ones. And you have to fill out detailed history. So let's ask here, so what's the issue here? The amount of money and the amount of time. And, I recommend 20 min for the consult, and you can decide what your fee is worth. $2 a minute, $3 a minute, $1 a minute. That's up to you and what your overhead is and how busy or not busy your practice is. That's up to you. We recommend a SMART or a questionnaire for sure. We like the SMART questionnaires. And we're building our own. A SMART questionnaire is something that branches. Well, here are 5 chief complaints. Pick one, and then depending on one you pick, it'll branch off into another area. So it's not just a linear questionnaire, but it's a branching questionnaire that can only be done online, obviously. And this is just an example of our SMART questionnaire with branching. And we if a patient fills that out ahead of time, then it makes it easier in that 20-minute period you've got to come to the point, to focus on what the issues are and to confirm that what they're telling you makes sense, and you can give them some advice. So what does Medicare pay? If you were a provider, say a physician, if you were a provider, what does Medicare pay you? Well, in theory, it might pay as much as they do in person. But, that's yet to be determined. I asked my colleague, Dr. Richeimer, who runs the pain center at USC Keck Medicine, and he's doing a lot of teleconsulting through his center. And he's saying, well, we think we're going to get paid the same, but wait and see. We'll know in a few months whether or not this relaxed set of laws to help patients that are homebound, sheltering at home, provides better payment or not. I don't think it'll last, even if it does pay better for now. But that's my best prediction. Okay, question 7. I can see there are networks out there. If you go online, you type in the word teledentistry or telehealth or telemedicine, you can see all these networks you can join. Now, most of the dentists have to join the teledentistry networks, and these are national networks so that if a patient calls up that network and they live in Arkansas and you happen to be in Arizona, they're not going to connect to you. They're going to connect to someone who joined that network from Arkansas. Or is licensed in Arkansas and has malpractice in Arkansas. So these networks, are they worthwhile? Well, they're pretty good in the sense that they connect you with patients in your area and patients who are seeking the expertise you're offering. They're probably very brief consults, 5 minutes in that range, maybe 10. And the fees are not very much. And you get a piece of that action, but not the full thing. And I doubt if you can make a living working through the networks. You really do have to create your own telehealth and provide it to your patients. And that's what I recommend. The networks are interesting. You could join a few, see how it works out for you. But I don't think it's a way to make a living, honestly. And we're not so interested in money at this point. We're just interested in helping our patients that need us, that can't come to our offices. We're shut down. So here's a telehealth for physicians. You can join this network, and what does it say here on the website? Telehealth understands why most doctors become doctors in the first place, to help patients live their healthiest lives and continue to gain knowledge in science and technology. Basically, patient calls up and says, should I take this medication? Am I allergic to it? And you have to answer. They pay so much a minute or an hour. They for a quick response to the question that's posed, it's a small fee. And here's just some data. I took this from this website here, their opinion about the telemedicine networks. There are dental networks, obviously. Here's 3 of them. This one, and this one. And if you didn't have time to write down their names, don't worry about it, because I have a PDF that you can get off our website that has all of these slides on it, plus some additional information not said in my lecture. All right, so these networks are there. You can sign up for them if you wish, and they will screen you and enroll you and hopefully connect you with people that are interested in your services. Now, here's an important question. Location. Where is it legal to consult with a patient? You're in your state, Arizona. Your patient has to be in your state. You can't cross boundaries because you're not licensed in another state. There's no national license for dentists. It's state by state. And you have to have insurance in that state as well. So don't think that because they're calling you and they know where you are, that's legal. It's not. You have to have somebody in your state. And the other part of the question was there exceptions to the rule. Yes, absolutely. The patient must be in the same state you are licensed in. Now, you might have to validate that they're actually in that state. Hey, are you in California? Oh, yeah, I'm California. Yeah. If their IP address is in Alaska, that's not in California. So you have to validate that they're in your state as part of your screening process. Now, there is an interesting exception for physical therapists, because again, physical therapists might want to cross state boundaries, just like dentists and chiropractors and occupational therapists do. So they have this PT license compact, and several states have said if you're licensed in that state, you're also licensed in ours. I don't quite know how that works because I'm never really dealt with that, but that's an interesting thing, and I'm hoping someday dentists have the ability to cross boundaries of states if there's a state law that regulates it. You can also go on to, you can have a network, you pay a small fee to join this website, and you can identify where they're coming from. What's location, not their name, etc. They'll give you the name, obviously, but you can verify their location. It's called geolocation services. And so you should probably be doing that. And this is just a map of the dark blue states are the ones that are joined the PT Compact for crossing boundaries. So any of you legislators out there, please allow dentists to do this if it's appropriate. And this is, I pulled off the American Telehealth Association that I go to regularly. And it is, waiving state license restrictions is coming, but it'll probably be for physicians. Dentists will be an afterthought, if a thought at all. And even here in this thing where they said you can cross boundaries if you're a physician, California is still not in that group. So, all right, question number 9. Assume insurance company documentation is the standard. So let's put this down, docs. You have to make notes. You can't just do this and not make notes, and you have to have detailed notes in your chart. So if you're going to be involved with insurance of any kind, if they do take teledentistry options, and you have to talk to your insurance providers out there, then you probably must meet the Medicare standard for documentation. They need to see that you've done everything you should do, and they audit you and they check on you. And if you don't have that and you ask for this fee through Medicare, that's a fraud if you don't document it. That's called fraud. So make sure you have and you understand the whole issue of Medicare H&E, history and exams. And this is not a lecture on Medicare H&E, which takes days and days to learn about and months to learn the practical aspects of it. But this is just a picture of what you need to charge certain levels in Medicare. 99212, you need at least a history of present illness. You need a 5-element exam, straightforward case, etc. And you can charge different levels if you have the right levels of documentation. Okay, number 10. Let's start up here. Malpractice insurance. You absolutely have to check with your malpractice insurance provider if you're going to do this, because they might have some weird rules depending on where you're located and what they expect from you and how it runs. So if you're interested in telehealth, please check with your malpractice insurance provider and your state board. Like I said, some states have some unusual laws trying to restrict this. And here's just a little piece that I cut out and put it in the slide. It says, what is malpractice? As a general rule, the policy insurance. What is malpractice insurance? As a general rule, the policy will protect you from professional activities that are considered normal and customary according to the rules and regulations of the state licensing board. So check with your state board, check with your malpractice insurance, make sure you're meeting the standards. Number 11, when you initiate a teleconsult, are they yours now? Are they your patient of record? And the answer is yes, they are, but you can also have limits of what you will do for them. It's called terms of service. And if you go to the networks, these things over here, they have terms of service for what they do. Basically, it's protect yourself from frivolous suits, limitations of liability and indemnity for expert content. And they say expert content is for informational purposes only, not actual diagnosis or treatment. Now, I disagree with that. I think you can do real diagnosis and real treatment for patients, but you have to have everything aligned properly. Okay, 12. That one was malpractice. And this one is RX. Can you prescribe? for a patient you don't have a physical exam on. Well, you can if it's obvious what should be done, but stay away from the controlled substances. Don't be a pain doc that's moving meds out to patients that don't need them, and you've never done a good faith exam on them. So be careful with that. But somebody calls you up with an abscess, and you say, look, you got to go see your local dentist, or because this looks like an infection, I'll give you some coverage for a couple days. Assuming you know their medical history and you've got them to fill out the pre-encounter questionnaires, then you could prescribe. But most people will not take that risk until the patient physically comes in to see them. Okay, what video consult system should you use? And I do recommend video, not just phone, but you can do both. Well, Zoom is the one that we've been using, and just Zoom got in the news, just a couple days ago, because apparently their encryption system isn't adequate. They were using some Chinese encryption system, and it wasn't the one they should use. I like Zoom. I think it's a great product, and it is being addressed. I've already upgraded to the latest version myself, and we'll see if they meet the HIPAA standards, which they have met in the past. But if you're going to use Zoom, and there's several others out there that you could use as well, then make sure it is. Go to the website, go to HIPAA website and see what they say about Zoom. And we're sort of in a state of flux right now. All right, phone. What phone system? Well, I like Google Voice. Now, I'm not being paid by any of these companies to do this. I think it's important for us to pick the best one that you're familiar with and you like. Skype is out there too. And make sure that, again, they're HIPAA compliant, and make sure that they have the features that you want. I like it because it protects my personal phone, which is what I use, by giving a masking number over it. So you can't see my personal number and call me back. And I can limit when I have access to that phone. I can put a message on there, so they call after hours. It just gives a message and say, I'll check it in the morning. If you're going to do Google Voice, you got to do Google Suite as well. And that's because that's the platform that it works under that is HIPAA compliant. So make sure you do Google Suite and Google Voice. And this is just a couple of screenshots from their website. And I like it. I think it's easy to use. There's several YouTube videos on how to use it. It's pretty simple. You'll like it, I hope. Again, I have no vested interest in that company. So what will you need on your website, assuming you have a website that people find you through, to get your teleconsulting service up and running? Let's talk about that. I'm sorry, I'm running out of space here. All right, what happens on your website? Well, you need a bunch of different things. You need a request form where a patient says, I want a teleconsult. And with that, they submit their name and their email and phone number, and your staff calls them back and says, okay, when do you want it? Here's the times they're available. And then we like the PHI disclaimer. Now, the reason I say that is personal health information is protected by HIPAA, but when they fill out a request form and it's sent back to you, that is really an exclusion from the PHI. It's just their name and phone number, and they're requesting this, so they're giving it to you voluntarily. And so there's a disclaimer. I'll show it to you in a minute. You need a terms of service. You say, here's what I will do and here's what I will not do. So that's important. And you also need to say, hey, it's a teleconsult. It's on the internet. So we'll do our best to protect everything, but it's not perfect. And then you need a good symptom questionnaire that you can use to gather data before they ever see you. You need a payment policy, which is important. Payment policy that says, hey, before I see you, you're going to have to pay. That's the rules for the way I do it. Unless you take their insurance and you have a good idea that you'll get reimbursed through their insurance and that they are responsible even if their insurance doesn't pay, that kind of thing. But you need a payment policy and you need a disclaimer and a consent. So this is our website. You can go to it and look at it, and our faculty. And this is our PHI disclaimer. And our request for information from the patient so we can set up a teleconsult. And here's our services agreement. We're rewriting this as we do this, so it may change, but we can go to our website and get it. Here's an explanation of the teleconsultation process, and that they have to live in California. And here's the pre-encounter questionnaire that they can download, fill out, and drop box back to you, or fax it back to your office if you have a fax number. And that's easiest. Paying for dental care policy, and this is, again, you're going to pay for this if your insurance doesn't cover it, that kind of thing. And then the informed consent policy you'll need. And again, you can go to our website and see what we've got and decide if you want them, or you rewrite and do your own. And there's many out there that you can copy or merge together. How do you collect money? That's the key here. Well, there are lots of ways. You know, if you go into almost any store, people are paying through their phones, and that system works fine. There's a variety of secure systems out there, and you know, they request. Here's the flow. They request it. You call them back and say, "Would you like an appointment for a teleconsult?" And they say, "Yes." Here are the times. "Yes, I can do that." Okay, you have to pay before we see you, not after. All right. How do I do that? Then you have to say, okay, do you have PayPal? Do you have Venmo? Do you have other direct pay systems? And they will pay. And then you set up the appointment, and once that's confirmed, then you do the consultation. That's the best way. There's a variety of PayPal, Venmo systems out there, and there's an overhead for that, just like all credit cards. You have to decide what that overhead is that you want to pay for. I'm not an expert on this payment system, but many of our millennials and Generation Zs are. So ask someone young, they'll know exactly how to do all this. So you can have them pay for it, and you can set your fee appropriately. And this is just examples of, here's Eventbrite. It's a system by which you pay per meeting. And I went and registered for something, and it was an $80 fee, and I figured out how much extra it would be. It was a $6 fee to do it through Venmo, which is about an 8%. So that cuts into anything you earn. Okay, where can I get more information? That's the last item here, info. Well, go to our website. We obviously have a website. We have two websites. We have a clinical website, but if you're really interested in this lecture and other things that we put online that might be of use to you, then you can go to our educational website, Ostrow On, because we provide educational services for dentists who want to advance their skill set and maybe get a master's degree or a certificate. So please consider our website and consider the online programs that we offer, and that's sort of the commercial that goes with this lecture. Thank you, and remember our philosophy. Constant change is the normal state. You better be prepared for the future because it will change. So thank you. Bye-bye.